Good morning and welcome. I know it's a little chilly out there, but I'm sure being here today, as it does to me, warms my heart and should warm your heart. This is a really important day for our healthcare system and for our community and for the patients that we serve. For those of you that I have not met, my name is Paul Lorenz. I'm the Chief Executive Officer for Santa Clara Valley Healthcare. Welcome again. First of all, I really want to thank all of you for coming out to celebrate the groundbreaking of our new Child, Adolescent, and Adult Behavioral Health Services Center. So this morning you're going to hear from and about many of the people responsible for the incredibly important and long-awaited healthcare facility. The new state-of-the-art facility, along with hundreds of dedicated healthcare professionals, will have a lasting impact on the lives of individuals and families for decades to come, and on the future mental health and well-being of our entire community. And I have to say, before I go on to other words, your Santa Clara Valley healthcare system, your county healthcare system, is here to serve the entire community and every individual that seeks help around their healthcare needs. We are very fortunate, and I feel very privileged to be part of a healthcare system that puts our individuals, our children, first in this community. Their health comes first, and their well-being. And I am privileged to be a part of this system and to work with so many healthcare professionals. Most recently, this healthcare system receives a lot of different accolades for the quality of care that we provide. If you don't know this, we were recently noted as one of the top 250 hospital systems in the nation.
Yeah. Whoa.
In the nation. And that includes not just Santa Clara Valley Medical Center, but also O'Connor Hospital, St. Louis Hospital, and our very robust and accessible outpatient clinic system. We should all be very proud of that. And today, we are talking about access to behavioral health services. So, first of all, and I'm sure you will all join me in this, I want to take this opportunity, along with all of you again, to thank our governing board, our County Board of Supervisors. Let's give them a round of applause. We simply would not be here today if our board did not have the foresight to commit to this project years ago. We're talking about hundreds and hundreds of millions of dollars to bring this project to fruition. And I mean, this took an investment many years ago. And it's funny, as I stand here today, I kind of sense Supervisor Joe Simidian behind me, reminding me and reminding all of us that this facility could not come soon enough. He was persistent, he was passionate, he was very clear to all of us that every day that would go by, there is a child and there's a family member that is looking for our support locally here in our own community. To Supervisor Susan Ellenberg, who serves as our president of the board, to Cindy Chavez, who is present here with us today, along with Supervisor Otto Lee and of course Supervisor Joe Simidian. About a year ago, they declared a mental health crisis in Santa Clara County. It is, as they have said repeatedly, a public health emergency. So with that being said, I think we all understand why we are here today and why this facility is so important to our family members, to our children, to our entire community. So without further ado, I would like to introduce our first speaker, our president of the Board of Supervisors of Santa Clara County, Susan Ellenberg.
Thank you, Paul. Good morning to all of you. Good morning to my colleagues on the dais. And I have the honor of quickly recognizing and acknowledging the many, many community elected officials who are here with us today, or frankly indicated that they would be here. So I'm going to read their name because they might be here and I didn't see them yet. But they include Senator Aisha Wahab, Assemblymember Ash Kalra, Sheriff Bob Johnson, Saratoga Council members Bilal Aftab and Tina Walia, Palo Alto Council members Pat Burt and Julie Lythcott Hames, Los Altos Council members Nisa Flieger and Lisa Schmidt, Los Gatos Council member Rob Moore, Campbell Mayor Ann Bybee and Council member Dan Furtado, Cupertino Council members Sheila Mohan and Kitty Moore, Santa Clara Valley Water District Board member Jim Bell, Allen Rock School District Trustee Steve Eckert, Cambrian Trustee Carol Prasunka, Foothill De Trustee Gilbert Wong, Fremont Trustees Naomi Nakano Matsumo and Rosa Kim, Los Gatos Trustees Catherine Sang and Daniel Snyder, San Jose Unified Trustees Jose Magana and Wendy Mahaney Gurahu, Cupertino Trista Satish Modatil, and Healthier Kids Foundation Nora Campos. Please join me in showing appreciation for all of our electeds. I'll come back to you too. As Paul noted, just over a year ago, Supervisor Lee and I introduced a resolution calling for the declaration of a public health crisis in Santa Clara County in response to mental health and substance use disorders, which was unanimously approved by the Board of Supervisors. The resolution was a formal statement of what we all know and see in our community, and so often in our own families. Santa Clara County is not unique in our challenges in meeting the growing need for behavioral health services. It is apparent across California and across this country. We continue to see concerning reports of higher rates of depression, anxiety, substance misuse, eating disorders, and other mental health challenges among children and youth, among healthcare workers, professionals, and individuals experiencing homelessness, truly in every segment of our community. Over the past year, county leadership and staff across multiple departments have redoubled and more their efforts to respond to this growing need. And thank you, Sherry Terrell, for being at the helm of that work. We are expanding bed capacity through new construction, refurbishments, and contracting. We're building out our workforce pipeline. We continue to build permanent supportive housing and prioritize recovery care as well as acute treatment care. I've been a member of this board for 4 years, but Supervisor Joe Simitian has been a champion for mental health for a decade on this board and has been, again, as Paul said, a relentless and inspiring force behind the facility in particular on which we are about to break ground today. Supervisor Chavez has been a leading voice for the well-being of children, youth, and young adults throughout her tenure on the board. Thank you to Supervisor Simitian and Supervisor Chavez for leading the way so boldly and so grandly. It is an honor to serve with you both. The Child, Adolescent, and Adult Behavioral Health Services Center will offer a much improved home for the care and recovery of adults, youth, and children who have acute mental health needs. It will allow us to decompress other parts of our system so patients can better flow through appropriate levels of care more smoothly. It is a key piece in the broader landscape of the county to expand the system of care across all levels, from acute hospital beds to long-term subacute beds, residential treatment homes, substance use treatment facilities, as well as community-based outpatient care and supportive housing. Today is an exciting and encouraging milestone, and I am so proud to be here with the leaders and partners who together will continue to build out the facilities, workforce, and coordinated system we need to provide excellent care for all of our residents. Thank you so much. And I am now very pleased to introduce my colleague, Supervisor Joe Simitian.
Well, thank you very much. I kept hearing the word relentless, which I thought was the politer version for dog with a bone, which is the way we describe this approach in our office. I just want to tell you how we got here today, at least how I got here today. In December of 2014, at a holiday party, my friend and constituent Sigrid Pinsky pulled me aside and asked me a very simple but direct question. Why aren't there any inpatient hospital beds for kids and teens in mental health crisis here in Santa Clara County? And in the moment, I thought, well, that can't possibly be. That can't possibly be right. So I went back to my office and I checked it out. And I discovered that it absolutely was right, and absolutely, positively, and undeniably wrong. Wrong. Just in so very many ways. Which, of course, prompted me to ask a series of other questions. How is it that in a county this big, we had no place for these kids? How is it that in a county this prosperous, we had no place for these kids? How is it that in a county where the need is so great, we had no place for these kids? And as it turns out, the answer was actually very simple and unacceptable. We had no place for these kids because we were shipping them out of town to hospitals far, far away. The need was so great that by 2016, we started to contract with San Jose Behavioral Health to serve a limited number of teens, age 14 to 17. And it's a help, but it's far from what we need to meet the demand, and it doesn't offer anything for younger kids. So all too often, at one of the toughest times in their lives, we're separating these kids from their families. They're away from their families, their friends, and their mental health caregivers. I rarely speak as a medical authority, but I got to tell you, this is therapeutically unsound. And frankly, it discourages families from getting their kids the help they need. They're already going through hell, and then the system simply makes things worse. With hospital beds in San Mateo, Alameda, and San Francisco counties in short supply, some of these families are referred to facilities in Vallejo, Concord, Santa Rosa, Sacramento, and because of liability and safety protocols, parents are often not allowed to drive their own children, which can mean hours in the ER, waiting for an available bed, and then paying thousands of dollars for ambulance transport, quite possibly out of pocket. So once I understood all that, I proposed that we create a place for these kids right here in Santa Clara County. And now, a little more than 8 years after Sigrid Pinsky first asked me that critical question, construction is underway. Finally, it's really going to happen. And while that realization is a source of some joy, I have to say it plainly. It took too long. It took too long. I say that because we're losing these kids. And so if I speak with a sense of urgency, it's because we have to act with a sense of urgency. We need to act like we're losing these kids because we are in every city and town in this county. We've got young people taking their lives, kids who are going to the very same high school that I went to some years ago, And for too many families, this is all too real, all too personal, and all too immediate, which is why we can't waste another day. Which is why we need to open the doors of this shiny new state-of-the-art facility as soon as we possibly can. Because these kids can't wait. Because we're losing them with every day that passes. Because every day of bad weather or delayed construction or just bureaucratic hesitation puts more kids at risk in a way that we just can't countenance. So I am glad, I am glad beyond description that we are finally going to make it happen. And that what today is just a great big hole in the ground will soon be the kind of acute care facility we have long needed in Santa Clara County for young people in crisis. A sanctuary, a place where young people can safely begin to heal, a place where they belong, right here, close to home. So to all who have made this day possible, I say thank you. Sigrid, where are you? Sigrid, thank you. Whether you knew it or not at the time, it was you who started us out on this journey all those years ago. And in fact, Sigrid, I want you to stand up so everyone can see you and join me in expressing our thanks for what you set in motion, whether you knew it or not. Sigrid, by the way, is today a member of our Behavioral Health Board, which is where she belongs to do even more good work. And I should also note that along the way, my colleague Supervisor Chavez leaned in to make sure that this facility will serve children with both psychiatric and medical needs. So I need to say thank you. Let me do that. Thank you, Cindy. Because of your efforts, we will do an even better job meeting the needs of the kids in this county. In fact, I need to say thank you to all of my colleagues on the board, as you heard earlier, all of my colleagues, past and present, who have been unanimous and steadfast in their support, none more so than my colleague, Supervisor Susan Ellenberg, who, as you heard, stood up to say, we've got to say out loud that the crisis is real, and it's here, and it's now. Susan, thank you as well. And only a handful of you will know, by the way, that our request for proposals, the RFP we put out all those years ago, Sherry, where are you? There you are. Well, our request for proposals failed to generate a proposer. So our county executive, Dr. Jeff Smith, said, you know what? We'll build it ourselves. And so we shall. And I can say this because Jeff had to be somewhere else today. Jeff being Jeff, he said, we also have an opportunity now to replace those aging facilities at the Don Lowe Pavilion with 42 new beds in a 21st century state-of-the-art facility. And again, so we shall. So thank you, Jeff, for all of that. And while we're taking a moment to give thanks where thanks are due, let me say thanks as well to all of our healthcare partners at Stanford, Kaiser, Pacific Clinics, El Camino, Lucille Packard Children's Hospital, our community health partnership friends, and many, many more. I say thanks because our healthcare partners in the community will not only refer their patients to this facility once it's available, they'll also bring their talents and their skills and their expertise and their experience to the work we do on behalf of these kids. In partnership, we can do so much more. But first, we need a place to do it. So let me say thanks again, even as I exhort us, one and all, to hurry it up, to act with urgency, to understand that we can't let another day pass without making a place, a space, where these kids can heal safely, securely, and close to home. If we can do that, this will be a day we can all be proud of. Thank you all so very, very much. Thank you. And now, Cindy Chavez, please come to the microphone.
Well, good morning, everyone. And I don't know about you, but I had this image of Joe over the next, 18 months is going to be digging holes in different places and checking it out. So we're going to have to give him a special little blazer, maybe a little hat. So when you see him out here, you'll know it's him. It's going to be a little bit of a Where's Waldo, Where's Joe at the new facility. And I want to just start with a very sincere thank you to Supervisor Simidian. One of the things that you learn in organizations as big as ours is that when you're trying to change the tide, you're leaning in all the way. And I want to thank you so much for leaning in all the way and doing it in such a persistent manner. Let's give Joe Simidian a big round of applause. I know that when the staff hears persistent, they think of all of us, and it creates bad dreams, I know. So we apologize for that. But it's based on the belief that we have in all of you, your skill sets, your focus, and your intent. That gives us the power to make the kind of change we want to make. And I too want to start by my own orientation to this building and the need for behavioral health services in our community. I was at a board meeting where a number of parents came forward, and in their little 2 minutes were telling the story of being separated from their children who had mental health issues, separated from their children who had medical issues on top of mental health issues, separated from their children and not in a place where they could provide the kind of love and attention that they wanted to while their children were going through such crisis. And I remember thinking at the time how powerful it was for people who were so in pain and going through that process for some of them right then, that they came and sat in a board meeting to say, we need help, and our children, by the way, irrespective of their age, our children are demanding that we change the way we provide services in this county. And their voices were so moving that I, like Joe, felt like this was an opportunity we couldn't pass up. And for so many, and I know many of you here have had your children suffer from mental health issues, and maybe you're still walking them through that process. The idea that you have to do that and fight a system, or worse than that, engage with a system that doesn't function like a system, is just making pain and challenge even more hard to address. So I want to again just say thank you to every single parent, every single one who raised their voices on behalf of their children and on behalf of other children. Let's give them all a round of applause. Many of you are here today. We appreciate you. We heard the need loud and clear. And this facility, what I'm so excited about this new facility, it will tie together medical, neurological, and psychiatric and mental health services for children, youth, and adults, and help us get the diagnosis quicker and address the care plans faster, because for so many parents, that can take years, and for so many children, they lose so much in that time. That's why what we're doing today is so critical and so important. And I want to wrap up, because when you're speaking in a lineup with this many people, the more you speak, the more you watch them start to cross stuff off their notes. So I'm going to leave them more to say. But I do just want to acknowledge this. We have so many behavioral health partners here that are part of our network, that if you are a provider, nonprofit or private profit, for-profit, could you please stand for us, our provider partners? I just wanted to say a very, very special thank you to each and every one of you. And Dolores, you should have stood up there. I see you didn't. So today we're here to start what I hope is a new chapter in integrated services. And I just want to acknowledge the leadership of our medical side and our behavioral health side, and the ability for us to further integrate services so that the patient doesn't know what system we're from. All they know is they're getting help. And one of our leaders in that area has been Dr. Sherry Terrao. Sherry, you never say doctor. So I'm just going to remind you, she's a doctor. She's one of the nicest doctors I know, but a doctor nonetheless. And I'm really, really honored to Sorry, doctors, I love you all. But I am really honored to ask her to come forward because the Board of Supervisors has gotten so incredibly focused on this issue that the weight and the pressure that's felt by our teams I know is real. And I just want to say thank you to her and to all the staff that have been trying to make those dreams come true for the patients that we're obligated and have the honor to serve in our community. Dr. Trejo.
Hi, good morning, everyone, and thank you, Supervisor Chavez, Supervisor Sumidian, and Supervisor Ellenberg. Today, with great excitement and appreciation, we break ground on the new Child, Adolescent, and Adult Behavioral Health Services Center. This new center will offer 77 beds to our community for children, adolescents, and adults, and will provide compassionate care to those experiencing an acute psychiatric crisis. We would not be here today without the many families, parents, and consumers of services and residents of our county that openly shared their stories of their child or loved ones who needed care, but that care was not accessible in their own community. We heard many stories of parents that struggled to be present for their child's care when their child was placed in a hospital outside the county. Thankfully, our Board of Supervisors and I appreciated the acknowledgement of Dr. Jeff Smith, our county executive, who heard these concerns and vigilantly pursued building our own facility. I also wanted to take a moment to acknowledge our former Behavioral Health Services Director, Tony Tullies, who was really part of the work with Supervisor Sumidian early on, a huge champion for children and families in our community, and who was really supportive of this effort. And while she's not in the position today, I did want to take a moment to acknowledge Tony. With the Board of Supervisors' declaration of mental health and substance use as a public health crisis in our county, we are growing to meet the needs of the people we serve. While we look ahead to the opening day for this new center, we continue to expand inpatient and outpatient services throughout the county. We are piloting programs embedding behavioral health care services with medical appointments for infants, toddlers, and young people, really looking at care through a preventative lens. Last year, we launched the 988 Crisis and Suicide Prevention Lifeline and trust teams to make sure our county residents have access to mental health and crisis services without involving law enforcement. And we have continued to expand our mobile crisis response programs. This new center will help us meet unmet needs and expand our ability to achieve our mission of providing the people of our county with the services and supports they need for better mental health and wellness. So thank you all for joining us this morning on this really momentous occasion. We're really pleased to have you here, and we're really excited for this center to open. And with that, I'm really pleased to introduce my colleague, Executive Director of the National Alliance on Mental Illness for Santa Clara County, or NAMI Santa Clara County, my colleague, Rovina Nimbalkar.
Thank you, Sherry. For 48 years, NAMI Santa Clara County has been advocating for families and individuals with mental health issues, and today I speak on behalf of those families and individuals. 12 years ago, Terry Downing, who's here with us today, daughter was misdiagnosed with mental illness, only later to find that the symptoms she was showing were only due to a neurological autoimmune disorder. Terry spent a year bouncing from one clinic to another, finding treatment, and just wanting her girl to be a person she was. Thanks to Dr. Kiki Chang and Dr. Jennifer Frankovich from Stanford Hospital, who were able to correctly diagnose Terry's daughter. But by then, it was a little late for her treatment, as her daughter had incurred severe brain damage, due to which she was because of not getting the right treatment for her autoimmune disorder she had. Terry, along with Supervisor Cindy Chavez, dreamt of the service center where we stand today, which has now become a reality. It took several years of advocacy from Terry, Kathy Forward from NAMI Santa Clara County, and so many parents who attended the Board of Supervisor meetings to advocate for this facility so that no other child and parent would have to go through what Terry's family went through. These parents brought pictures of their children and made sure their voice was heard. We are so excited about this service center and feel proud that our county to build this with close proximity to the medical services so that no child, adolescent, or an adult will go without getting the correct treatment. This new state-of-art facility will serve all people in Santa Clara County regardless of their age. Thank you to everyone who has made this possible. Now, please welcome the President and Executive Director of VMC Foundation, Michael Elliott. Thank you very much.
Thank you. Well, hi, folks. I've got great news. I'm the last speaker. I want to start out. I'm Michael Elliott. I'm the very proud Executive Director of the Valley Medical Center Foundation. Grateful to be on the stage with you here today. I want to quickly acknowledge some folks without whom today would not be possible. Starting with, from the County of Santa Clara Fleet and Facilities, Jeff Draper, Doug Koning, Paulo Garcia. You have worked tirelessly with staff, designers, and contractors to get us to this point. Congratulations. This beautiful facility was brought to life by Craig Blackhurst and the design team, including HGA, Cunningham Group, and Arup Engineers. A round of applause for those important partners. And I also want to acknowledge Tolga Akar, Vice President of Webcor, and Al Mateen, CEO of S-Bay Construction, for their work to get us here today. Thank you all for your fantastic work. And last but not least, to the great team that organized this event, thank you for getting us here. The weather you ordered was perfect. And as a reminder, immediately after this, you're all invited to join us at the VMC Foundation headquarters, which is just, if you see the stop sign at the end of the road, we're just past that. We have some food and we have central heating. So please join us. Please join us. Just one thought I want to share before we can conclude. And it has taken a tremendous amount of hard work to get us to where we are today, thanks in no small part to the people on this stage. But I think we all know that the real hard part is going to start the day this building opens. There is so much unmet need in this community, so many families with loved ones suffering from acute mental illness. And I think a lot about what it's going to be like for the folks that go to work in this building on that day one. And they're going to face a crisis. So what can we do to support them? Well, I've got one idea, and thanks to the support from my board of directors, later this year, the Valley Medical Center Foundation will launch a campaign for what we're calling a startup endowment. Because I know two things will be true about this building. First, it will be state-of-the-art. And second, once it's open, things none of us could have foreseen will be needed and needed urgently. So I think the challenge for us as a community is, can we raise some dollars to make sure that those folks that go to work on that first day have every resource they need to take care of our patients? There's a lot of things cycles we want to break with this building, and one of them is the underinvestment from philanthropy in mental health services. So I'm hoping you can all join me in that effort. To do that, I need your ideas, I need your advice, and yes, eventually, I will need your giving. But before that, we must officially break ground. Now, please ignore the big hole behind me. That's from something else. This is the real groundbreaking that's happening here. So if everyone on stage now could join us we have to put hard hats on and get shovels, and we're going to break ground. Thank you all for being with us today. I hope to see you all at the reception immediately to follow.